Doctor, what are you doing right now?
Always important to start off with a weight. Oh, stop. 37.8 kilograms. Oh, 37, hold on. Yep, 37.8, okay.
So
Gabby, step up.
His weight is good, yeah?
I'll assess him when I gotta have a feel. It's not just about the number of dogs,
Okay,
also
yeah,
about
dynamic.
how they feel as well.
Yeah, okay, come on.
Just like every human's built different, every dog is built a little different as well.
Gabby, stay. Oh
41
my
kilos.
goodness.
So,
You're overweight again.
unfortunately, I agree.
Came to examination room. This is Gabie, Coco. I think this is picture of Marmora. There's another cat. Gabie, you gained weight. We need to be on diet now again. Coco is okay. Coco is good. Waiting doctor right now.
The crux of what we do is, this is where artificial intelligence will never really replace us, is the use of our hands and how the patient feels, right? And that's when we were talking about Coco's weight. And let's start off with weight first. This is an easy place to start. So what do we look for when we're looking at a dog's weight? We look at three places. We look over the ribs. So feeling Coco right now. I can't feel the ribs too easily, but I can still feel them. And then is there a nice pinch behind the ribs? And is there a nice tuck? So a tuck underneath and a pinch. So I would assess Coco as a good weight. We score them on a scale of 1 to 9. 1 is very, very too thin. 9 is very, very too fat. Between a 5 is what we look for. And I would assess Coco as a 5. So a good weight. Now we move over to Gabie. With Gabie, I can't really feel the ribs as easily as I should. So that's when we assess her. She's not obese, but I would score her as a 6. So it's mildly overweight. As I was touching Coco, and this is where, again, our hands are so important. Were you aware of this fat deposit on Coco's ribs? And do you feel like that fat deposit's changed over the last, say, year or so?
I think it's shrinking little. It's shrinking little bit. And I check often if it's moving freely.
Good. So the other thing I do is that I also measure it. So these are calipers. These are just simple things you can get off of Amazon and things like that, but they're important because they actually, we used to always assess everything like a fruit. Oh, it feels like a grape. It feels like an orange. And that's just not, it's much more accurate to get actual measurements on this. So you can see I assess that as 6 centimeters exactly. So we will keep an eye on that. We will. So with lumps and bumps, we watch for changes. Thank you, Gabby. We watch for changes. If they get hard, if they break open, if they grow really quickly, those are the ones that should be sampled. And that's something that's pretty straightforward to do. Doesn't need sedation or general anesthesia to do. We just take a simple needle, we put it in, we check, and make sure all is well.
And we did already once.
Exactly. So that's why, do we need to do it again? I don't believe so at this point in time. So that right now, that's 6 centimeters sitting over her 12th rib on her right side. And it's fairly low down, not quite on the underside, but on the lower part of that 12th rib there. So we'll keep an eye on it. I'm going to check her out for any other lumps or bumps, and then we'll start a tip to tail exam from there.
I checked, no, I didn't find
anything.
Yeah, I didn't find anything.
Good. That's another important thing as well, is that ongoing conversation as well, just to make sure, because I see them for 30 minutes, once to twice a year. You see them 16 waking hours a day, 365 days a year. So having that conversation is very good.
Put your hands on dog,
Exactly. So, I'm going to just be shutting off the lights. I'm going to take a look in Coco's eyes. Coco's the phenomenon we see is lens hardening. Lens hardening is a normal, natural. Confuse that with cataracts, and they're not cataracts. It's going to be difficult to see, but at the 3 o'clock, if the eye was a clock, it'd be about the 3 to 4 o'clock position. There's a bright white spot right on the edge there. That's called a polar cataract. There's 2 types of main cataracts. We have our central cataracts. Those are cataracts most people think that. Those are the ones in front of the eye. Coco's actually sits off to the side.
Okay.
These side cataracts don't tend to cause problems that central cataracts can. So you typically one that's the one I let you know about. We keep an eye on it. In big cases where people are worried, yes, there are special eye doctors for dogs called veterinary ophthalmologists. It's not my recommendation that Coco needs to go to see that, but I'll keep an eye on that cataract because not every dog develops a cataract. Well, almost all dogs, when they get old, will develop the lens hardening, which I do see that little bit of gray in his lenses. That's normal. Cataracts, though, we keep a close eye on them to make sure they don't cause other problems. So that's Coco's eyes done. Ears are next. So what we're looking for is making sure those beautiful ears, there's not any redness or anything like that in the ears. We always make sure to get the hair out of the way. Yep, nice looking left ear.
No smell. Yeah.
Exactly.
Healthy smell.
Nice looking right ear. Good. Move on to teeth next. So this is exactly what I want to see with a dog of Coco's age. Beautiful pink healthy gums, very little tartar on the teeth. Teeth are looking beautiful on this side. Maybe a touch of gingivitis, a little bit of red right there, but overall really, really good for his age. On this side, same thing as well. Looking for any broken teeth or anything like that, and just not seeing anything to worry about. So you're doing a great job with his oral health. Good. Excellent. Having a feel on his neck next. There's lots of things that live in the neck, like his saliva glands, some lymph nodes, all which feel normal at this point in time. Move down to the lower ones. Good. Using my stethoscope. It's not just for decoration. Definitely always want to take a listen to heart and lungs. We're listening for two things. How it sounds. Are there any abnormal sounds? Also, is the rhythm proper as well?
Gabie, quiet.
Nice normal rhythm. Just going to take a heart rate now. .104 beats per minute, which is totally normal for a stressed dog. Good rhythm. Lungs sound good as well, which is excellent. Good. Have a feel of the belly next. As they get older, very important to have a feel of the belly because sometimes things can crop up there, like lumps and bumps that shouldn't be there, but there's nothing there with Coco. Everything as that should be. Other thing with senior dogs, we look at mobility. So we start stretching around. There is a little bit of discomfort there on full extension there. It's not unusual for a dog at his age to start showing signs of arthritis. Is it bad enough he needs formal medicine yet? No, but we had talked in past about using fish oils with him. What always amazes people is that dogs need a lot higher fish oil than sometimes even humans do.
They have fish oil every day.
Good.
Yeah.
Keep up with it. It's a good thing for heart, good thing for
I give
joints.
them collagen also.
Good. Thank you, Gabby. Yeah, so just little clicks in his wrists as well. Sometimes that can just be joint fluid. It can also be sometimes be signs of arthritis.
It looks like a little bit muscle loss on rear legs. He's avoiding jumping now.
I wouldn't disagree. It's tough to kind of tell because it's not like it's super flat. The muscles, so we assess those back muscles here. They might be a little bit softer than I remember. It's not severe wasting, but I would definitely not disagree. There's probably something going on back there. And at his age, it's not surprising. Good. Overall, that's good.